Today we are at the Kisumu Heart Centre, a specialist center for cardiovascular diseases. We are going to be speaking with Dr. Nalwa,
physician and cardiologist.
a physician and cardiologist. Welcome.
Thank you.
So, in simple terms, what is cardiology?
Well, cardiology is a branch of medicine that deals with illnesses of the heart and blood vessels. You study the function and you study the diseases, and so you are able to provide treatments, investigation and treatments to try and restore order and function in that system.
Okay. How do you detect heart conditions?
Detection of heart conditions, it takes different forms. The first way in which you detect a heart condition is just a patient talking to you and telling you what they are feeling, what's going on in their lives, the limitations they are experiencing, and then you can add them up. It's like having a list of qualifications. So if you hear 1, 2, 3, 4, 5, then they point towards heart disease. So what you then need to do is to be able to confirm. So for example, a patient may come in and tell you, Dr. I feel very tired. These days I cannot walk the way I used to. I cannot walk the way I used to. I cannot even sleep. Whenever I try to sleep, I feel breathless. Whenever I try to sleep, I wake up coughing. Then those are pointers that it could be a heart problem. There are others who will come and tell you, I have been treated for a heart problem. Mm-hmm. There are others who will tell you, I have been treated for a long time for a cough that is not going away. Then when you examine them, you find they have a heart problem. So the first step is always to listen. Let them just speak and tell you. It's like a history. We call it history of illness. Then the second stage is you examine them. So after listening to them, you put them on a couch and you will examine them. So you want to see how are they walking, you want to see how are they sitting up, you want to see how are they lying down. And then you go systematically examining their body with a view to find out what issue they could be having. So you will not focus on the heart only, you will examine them completely. And then depending on the findings you have, then you might decide that it's predominantly a heart problem. And the reason why you need to examine the whole body is because you can either have heart disease on its own, or you can have heart disease as a complication of another part of an illness of a different part of the body. So the second step is always to examine the patient. And that is the reason why some people have found it difficult to conceptualize having telemedicine, where you are just talking to a doctor without examination, because how do you verify which part of the body is sick? Then the third step is to go ahead and apply technology. So we have equipment that we will use to see the electrical activity of the heart, to look at the mechanical activity, to literally see how it is contracting, how blood is flowing. Then there are others which are dynamic. So you are put on a stress test and then you are asked to walk. So we will increase the slope and the speed and see how far you can go to try and imitate real life. Then depending on how severe the illness is, you may end up going to a specialized theater where we are able to introduce some tubes direct into the heart, and we're able to inject some dyes and to see how blood is flowing. So you listen to their history, to their story, you examine them, then you do testing. Now, testing, the ones I've described, is imaging. So you produce images of the electrical activity or functional activity, but also you may need to do blood tests. Blood tests will again look at different aspects. Once you get that information, that's what you now use for treatment.
So these technological equipments, what are they?
They are different. So the most basic is this, a stethoscope. So usually we will take it and listen, okay? We will listen. So basically what it does is since you cannot listen to things in the heart with your ear, so this one magnifies the sound, so you can hear better. Then the second one is called an ECG. You are shown, but I'll show you. We put some electrodes on the chest, connected to a machine with a screen, and it's able to record what's going on in the chest. So it will give you some tracings, which will show you how electrical current is flowing. So there is a normal pattern of conduction of current in the heart. So that normal pattern may vary for different reasons. For example, if the heart has enlarged, it means that the current will be more. If the heart is surrounded by water, it means these things on the heart will not pick the signal properly, so it will be very small. If the heart has had a heart attack, since that area is dead, the pattern of current flow will change. If the electrolytes that are a problem, then since electrical current is generated by energy changes occasioned by again it will change. So it will show you a lot. So an ECG is usually the most basic, and even in detecting a heart attack, it's the one that we use the most. Then the second one is ultrasound of the heart. We usually call it an echocardiogram. Echo, so it records sound waves. That's why it uses echo. So you put a probe on the area where the heart is and where the blood vessels are, and you can be able to get images that reflect how blood is flowing. The other one is a stress test. It looks like a treadmill, the one in the gym. But now that one, you connect that plus an ECG, the one that gives you electrical activity. So as someone starts to walk, you can see if that electrical activity pattern is changing. There are others that we may not go to without seeing the pictures or seeing the images, but basically those are the ones we use.
So do the ECG and the echocardiograph, do they have an effect on other body parts like the X-rays and?
No. These ones don't have an effect because they only record. An ECG only peaks. Unless it has an electrical problem, it has no negative effect on the heart. That's why it is licensed to be used freely without any limitations. The same thing to echo because it uses the same technology as ultrasound. The ultrasound we know. Yeah.
So for testing, some doctors usually refer you to other medical centers to go take tests, and then you can present it to them, then they work with it. Do you in this center do that, and can you interpret those tests from elsewhere to use on the patient for treatment?
Heart Centre here, we noticed there was that gap in this region, the whole region of Western Kenya. There are very few places that can do that. Actually, we were the second to Aga Khan in Kisumu to be able to offer those kind of services. So we do the tests and we interpret them. We make decisions on the spot. Because if someone has come from Beta, 200 kilometers away, you don't want to say you're going to just give them a report and they go home with it. No. You want to look at the report, see what are the implications. What are the implications? What are the findings, implications of that report? And then help them to make a decision. So that as they are going home, then the test is useful. Because you do a test to find out what's happening. Once you establish what's happening, then you need to take action.
Okay. So at Kisumu Heart Centre, I understand you deal with patients of, there's no age boundary.
No, we have no limit. We started off as an adult center only, but then I've worked in this region for over 18 years, and I know the limitations of the region. There are many children who are suffering. They have rheumatic heart disease. They are born with heart conditions for which nobody knows what's happening. So we then went ahead to offer free service. So for children under 15, we screen for free because that's how we are giving back to the community. We are helping them to find out why they are not growing properly. We are helping them to find out why they are not able to go to school. We are helping them find out why they are just limited. Children are supposed to be free. They are vulnerable. They are supposed to take care. They are supposed to grow, learn and grow. And we are contributing to that process by providing free screening for them.
So right now the country is under the pandemic period. For starters, have you treated any patient diagnosed with coronavirus?
One, let me say that during this period we've experienced phenomenal growth because we opened our doors to people who are having challenges going to where they usually go for care. So there are people who usually go to Nairobi, there are people who usually go to Eldoret, there are people who usually go to Nakuru, and now they were restricted. With the restrictions, what were they supposed to do? So we opened our doors and said we are available. So we never closed during the pandemic, but we ensured that people are using masks. And mine is here. We ensure that they are using sanitizers, they're there, and we ensure that there is spacing. And then we ensure that our waiting areas are not packed. So with the spacing, we created an additional space where people wait outside. So have we treated people with corona? We have not treated people with corona because at the moment we are not admitting. But we have encountered several people with symptoms of corona who have turned out to be positive. So they come in, they are breathless, they are feeling tired, and things like that. We check the oxygen saturation, it's going down. We've always referred them to where they can get care, and they have got care.
Okay, so do you also perform heart transplants?
No, in Kenya, we don't as yet have centers for heart transplants. So we do not do surgical procedures directly here, but we do pacemakers with other hospitals. We've had around 4 or 5 patients. We've had pacemakers. So pacemakers are devices that are used to when the heart is too slow. There's a problem with electrical conduction, so the patients come in very tired, breathless, so the only way is to put in a machine to speed it up. Yeah.
So why should I choose the Kisumu Heart Centre for my heart disease?
Because we are a comprehensive center for heart disease. If you come here, you'll find a qualified doctor to attend to the patients. You will find the equipment required, you will find lab ready, you'll find pharmacy. So when you come, you get services on the same day. You are told what is required. If you need referral, then you will be referred appropriately. Yeah.
So thank you so much, Dr. Nalwa.
Yes.
It was a great conversation with you.
Thank you.